Thanks. Well, it's a really good opportunity to be here and to contribute to the interesting discussion. My presentation actually picks up on a few of the things which each of the other presenters have been talking about. But really, I'm going to spend the next 10 minutes also talking about the importance of taking a gender approach to the MDGs and outlining some of the ways in which development policy and programming can really strengthen ways to promote gender equality and to promote women's empowerment for the achievement of the MDGs and beyond. But it's also really important to, when we talk about where we are today, to look at the achievements that we've also made so far. And it's important to look at how gender has actually got onto national and international debates in recent decades. And really that has been moving from a women approach to a gender equality approach that recognises the relations between men and women are often unequal, which also recognises that both men and women face inequality. And this has really been central to development debates over the last couple of decades, and it has resulted in some specific commitments and platforms, such as the commitment to Convention Against Discrimination and the Beijing Platform of Action in the 1990s. And this has really galvanized attention to gender, not only in terms of putting it in terms of increased visibility of gender, but also making it central to poverty and development debates, which has then put in motion particular concrete actions, tools at a national level, which really try and support progress towards gender equality. And it's really within this context that we also note that through the development of the MDGs, gender is a central component of two goals, MDG 3 and MDG 5. And this is a really important first step to making gender visible. But what it does is actually make it slightly more invisible throughout the other goals, whereas gender equality is intrinsic to all of the goals, not just MDGs 3 and 5. And this narrow approach has made gender equality less visible. But if we want to talk about the MDGs, if they are to be achieved and if poverty reduction is going to be achieved post-2015, we must take an understanding of how gender equality cuts across all of the goals. And just a couple of examples that, for example, in MDG 1, which is reducing income poverty and food security, that there should be an explicit recognition that while both poor men and women are overrepresented in casual wage labour markets, they face low wages, vulnerable work, women are particularly overrepresented in this sector. They receive lower wages than men, often because they don't have as much education, but also through discrimination, they're paid lower wages than men even for the same jobs. We've heard a bit about the economic crisis as well, the economic crisis, the food crisis, and the way that has differential impacts on both men and women as well. A lot of unemployment and underemployment has hit low-skilled workers first, where women are highly represented. Intra-household inequalities over access to food, over allocation of resources, means that it's often women whose consumption is reduced first. Women also face more barriers in access to and ownership of productive assets, such as land, for example, but in many countries, they're the primary agricultural labourers and workers. In terms of MDGs on education, health, environment, water and sanitation, social services, enormous challenges, as we've heard, remain to achieving these goals. And there is growing evidence that gender dynamics are also intrinsic to accessing services. Men and women, boys and girls, they face different challenges because of a range of both biological but also social and cultural factors. Again, the division of labour within the household means that women have higher or more responsibility for domestic work, and on top of that they have productive activities as well. And this often leads to time poverty, so women find that they don't have time to go to access healthcare centres. They can't take their children, walk their children to school. Intra-household relations again and power relations in the household mean that women often have less decision-making power over their own healthcare when they want to go to the healthcare clinic or not. There are also some examples of in some parts of Africa where there are some cultural and social fears over immunisations leading to sterility amongst boys. So there we find that actually boys are discriminated against in terms of not receiving full immunisations. So these are the kind of things which cut across all the goals, and we need to remember that these are intrinsic to achieving the goals and not just focusing on MDG 3 and 5. But there are ways that we can ensure that that gender is taken more seriously across the MDGs and can strengthen commitment, objectives to addressing the barriers that gender inequality causes for poverty reduction. So when we think of what we want to achieve in the next 5 years, what we want to achieve post-2015 in a development agenda, it is absolutely crucial that we build on the achievements that we've already been made or already being made at an international and national level in terms of strengthening commitment to gender equality through, for example, gender mainstreaming tools, ensuring adequate resources to women's empowerment through civil society organisations, through governments, strengthening national and international institutions, so donor institutions but also ministries of women and empowerment, strengthening these institutions to actually deliver the promises that they've made on their commitments to gender equality. But there are also some practical programming tools as well which can be made, not just sort of at the high policy level and entrenched in politics, but we've been doing some work on social protection. We heard a bit about the importance of social protection in terms of reducing poverty and vulnerability. There's been increased popularity in many middle and low-income countries of cash transfers, public works, employment programs, social pensions to reducing poverty and vulnerability. And the way that gender has been conceived or programmed across this is very variable. But there are some really positive examples, and one of them is the productive safety net program in Ethiopia, which is an employment generation program which covers 8 million people. And it has, over the last few years, it's evolved and has increased its commitment to and design features, including gender-sensitive design features. And some of those are they're quite practical then, they seem quite obvious when you say it. So, for example, they ensure that at least 1/3 participation on the employment scheme are women. It ensures that equal wages are given to both men and women. It provides childcare facilities so that women can leave their children and engage in productive activities. It also provides alternative support to pregnant and nursing women. So it provides a direct cash transfer, so they don't have to engage in heavy labour public works programmes while they're particularly pregnant or nursing. It also provides flexible working hours to accommodate both women's domestic and productive responsibilities, creates gender-sensitive community assets. So it thinks about where, for example, a well should be placed in terms of helping to reduce women's time poverty or closer to home so that women don't have to go so far to collect water or fuel wood. And also, it's also promoting participation in programme decisions, so encouraging women to actually raise their voices and make decisions about the programmes, about the community assets. So these are all really positive examples of how gender can be included into programme design. But the PSNP in Ethiopia, as well as other social protection programming, often faces significant challenges in terms of realising these design features through to the implementation, so that we find actually in practice childcare facilities are rarely provided or prioritised, that the type of work which is allocated between men and women mean that women actually often receive fewer wages because they receive fewer days' work because they're given the light, soft work, and it's prioritised to men. And often women aren't consulted in programme design from very simple issues that they're not able to join to join programme consultations because of the timing, their domestic responsibilities, but also they're unable to raise their voice and to have a sort of quality participation in such community areas. So it really highlights that there are some important areas for both increased and sustained political commitment and financial resources to ensuring that these kind of programming tools actually reach down at the implementation level and make a difference on both men and women's lives. And some of the areas to support these kind of programmings would be capacity building about gender-related programme aims, both at the policy level but also at the programme implementation level. Better coordination between ministries, so for example ministries of agriculture, ministries of women, ministries of social affairs and other agencies, and actually delivering these kind of programmes. And also better data and monitoring evaluation that's disaggregated by sex at a local, individual level in order to feed back these kind of issues which often become invisible, to make them visible in policy and programme design. So therefore, what we want to stress is that to achieve progress on the MDGs, gender shouldn't just be seen as a tick box, as a technical task, but it actually has to be seen as intrinsic and central to achieve poverty reduction goals and to achieve the progress towards the MDGs. Thank you.
Okay, thank you very much.